This is a video on intraosseous treatment of bone marrow lesions in the knee. Here are the disclosures. The first step in this entire process is to obtain the bone marrow aspirate. There are two approaches to the iliac crest. In the anterior approach, the patient is supine and a Jamshidi needle is placed 2 centimeters posterior or superior to the ASIS at a maximal depth of 4 centimeters. A total of 60 cc's is aspirated. In the posterior approach, the patient is prone and a Jamshidi needle is placed through the outer cortex of the PSIS. Again, 60 cc's is aspirated. Next, identify the tibial plateau and or femoral condyle based on where the bone marrow lesion is located and administer local anesthesia using the formulary listed here. Anesthesia is injected in 5 distinct sites. In other words, if the red dot is a landmark, anesthesia should be injected at each of the blue dots. 3 extra milliliters of anesthesia can be applied when preparing the femoral condyle location due to increased sensitivity of the skin in this area. There are 2 routes to the bone marrow lesion of interest. The decompression route involves accessing the bone marrow lesion through the nearest cortex, while the biologic route involves deliberately drilling through healthy bone to promote healing. Before injection of the biologic, a trocar biopsy needle system is used to aspirate local marrow equal to the amount of biologic to be injected. This demonstrates the technical setup to inject bone marrow aspirate concentrate into the tibial plateau of the patient's left leg. The patient is supine and a radiolucent bump is placed under the lower leg to elevate the extremity and allow for optimal intraoperative imaging. For the decompression route, ultrasound or fluoroscopy can be used to make skin markings representing the straight line route to the bone marrow lesion. Using the 2 skin markings, a small stab incision is made and a K-wire is drilled through the nearest cortex parallel to the joint surface. A 0.4 millimeter reamer is then used to decompress the intraosseous compartment, increase blood flow, and increase the area of the biologic. This image is another demonstration of the decompression route. Image A shows a bone marrow lesion on MRI at the lateral left tibial plateau. Image B shows core decompression of the bone marrow lesion through the nearest cortex on fluoroscopy with the patient laying supine. On the other hand, this image demonstrates the biologic route. Here, the proximal anterior cortex instead of the lateral cortex is drilled to access the bone marrow lesion seen in the posterior-inferior aspect of the right femur on fluoroscopy with the patient laying supine. This is thought to stimulate bleeding of healthy proximal bone and introduce biologic tissue to the lesion. Image A and B show the anterior-posterior view of the biologic route, and image C shows the lateral view of the biologic route on fluoroscopy. Thank you.